So I want to get to a few things that I meant to have earlier in chapter 6, but I want to get your test finished first, and so that's why I skipped this part. So we're going to do a few things that would have been in chapter 6 I just skipped before going to chapter 7. So this will be on the next test, yeah. I'll just include whatever we're starting today and onward will be in chapter 7 test. So we'll talk about a few things about muscles and bones before moving on to the nervous system in chapter 7. Ankylosing spondylitis is a rare kind of arthritis in the back. It causes pain and stiffness in the spine and in the hips. So the name is really strange, but ankylosis means fused bones. And so the bones actually harden and fuse together in this condition. And so we learned this before, that you have vertebrae with discs in between them. That lets them be flexible and move around. In this condition, the bones fuse around the discs. And basically your spine just becomes like a steel rod with no flexibility at all. Your spine becomes immovable in this condition. And spondylitis means inflammation of the vertebrae. So basically, this name is implying that you have inflammation, you have pain, you have swelling in the vertebrae, and then it hardens that area.
Can it only affect certain parts of the spine, or does it happen to the whole spine at once?
It depends on, so you have different severities of this condition. And so sometimes it only affects parts of the spine. Like maybe just the sacroiliac joints, which would be the parts where the ilium fuses to the spine right here. That's usually where it starts, is the lower back. And so the very beginning stages, you have lower back pain. And you have stiffness in your lower back in the mornings, especially. And then throughout the day, it gets better. That's usually how it starts. And after that, it just progresses upward, generally. And it could only affect your lower spine throughout your life, or it can move on and affect your whole spine. Just depends on the severity. It's usually worse in males than females. The younger you are, when you have this, the worse usually it gets, but it really just varies from person to person. But you can see in the last stages of it, you just have this fusion.
Is there any way to like undo it?
No, you can't undo it, but you can take medication that can help slow it from going on and infecting more of your spine. Doing stretches, being active can help too. Certain steroids can help.
Is this genetic or is this one like anyone can get?
It can be either. It can be genetic or it could be autoimmune.
The glass of the thing was shifting.
Wait, what?
The glass from the trash just started shifting.
Well, that's weird.
Wait, what?
I guess
Coming back to
Hey, Johnson, tell me.
yeah, it's fine. But it's very rare. It's not very common at all. But I told you before about this. I think, remember I told you that, I had this time when I was paralyzed, basically I couldn't move. And I went to the doctor for this and he said, have you ever heard this before? And I said, no, I haven't. But he gave me a pamphlet and he said, you probably have this. And so I went home and read this and it's like, oh my gosh, I'm paralyzed. So I'm gonna just have this. And basically what happens as you get older, you get this hunchback and basically you stay that way and you can't move your spine at all. And so I remember going to church and like seeing people who are really old in walkers, and they're like hunched over, like I'm gonna be like that in a couple of years. So it was pretty bad, but no, my doctor told me I did. But they did more testing and probably don't. I don't. I mean, if I did, it'd probably be a lot worse at this point, I would think. But it's very rare too. It's not very common at all. Sprains. When you have a sprain, you have injured a ligament, and ligaments connect bone to bone. So one common area for a sprain would be your ankles. You have a lot of ligaments attaching the bones together. There's different grades. You can have a grade 1 sprain where it's mostly just stretching your ligament. You might have some small holes that have torn in your ligament, but for the most part, it's just stretching. for grade 1. Grade 2, you have a tear that's larger. In grade 3, you have a complete break in your ligament. Grade 3, you usually need surgery to repair it. A common area of injury besides your ankle would also be your knee. MCL, ACL, PCL, these are all ligaments that are easily torn. So even knee sprain, usually you have one of these ligaments that has been injured.
Are they easily like torn, or are they just like those are the ones that you most likely will hear if like you get hurt?
Well, yeah, if you get hurt, those are the ones that are going to be torn. I mean, they're not easily torn. I mean, you need a lot of force to tear them. But if you do get a sprain, that's usually the areas you're going to get the sprain, is your knee or your ankle. And then a strain would be a tearing of a muscle or a tendon. So a sprain is always a ligament that's torn. A strain is your muscles or your tendons that have been torn. One common area for strains would be also your knee. You have a lot of muscles that connect to your knee. And lots of times you get the injury through twisting. And that's why a common site of injury is your ankle and in your knee, because those are easily twisted. One sign of a strain or a sprain is a popping sound, because that's basically what you're hearing is the tearing of a ligament or tendon when that happens, popping.
So can you strain your like neck or like your back if you like?
Oh yeah, you certainly can. Yeah, if you have pulled a muscle, basically that is a muscle strain where you've torn a tendon or muscle part. So that's what pulling a muscle means. So back is definitely a common area where you also can strain and basically tear part of the back.
Is that normally from like trying to lift it up?
That's certainly one way you can do that. Yeah.
How else do you really strain?
I mean, if you're playing sports,
Yeah.
that would be definitely another way you can do that. But any kind of quick twisting motion can also do this, even if you get up really quickly. That especially when you're older. I mean, not so much when you're younger, but any quick motion at all could also tear your ligaments or your muscles. If you don't stretch properly, that can also, like stretching before sports or just in general, that can also make you more prone to being muscle strain or sprains. Let's look at different kinds of knee injuries. First one's called runner's knee right here. And what happens, you can see there's this cartilage behind the kneecap right here that normally cushions it and makes it frictionless as it rubs against the femur. But if you use it a lot, especially in running, then you might wear away the cartilage and then it becomes very painful.
So you shouldn't run.
As long as you rest it, you're fine. I mean,
Is that why they say not to run on the same bed? Is it for that?
I think it's more about, well, you could say either way. It's like pecan or pecan. I mean, you could say either way. I mean, yeah, I know you can. If you go up north, if you go up north, they're gonna say it like that. They're gonna say cement up north. I mean,
Cement. Is that why they say cement in the south?
I think that's more about your feet.
No, I understand they say cement. But I could be wrong.
Maybe. I mean, I know they work together. I mean, I'll have to look and see, because like I suppose it would hurt both. I mean, I would imagine it's just better all in general in your body to be on a softer surface. Because if you impact the ground, it would reverberate up to your knees and even your back. So I would assume it is for all, not just your knees, but also your feet. So this shows you different parts of the knee that might be injured and what those injuries are. So the first one up here, that's runner's knee. You're gonna feel it on your kneecap. Patella tracking. Does anybody know what patella tracking is?
I'm guessing something to do.
Yeah. You know what that? I see your kneecap, right? Moving. Yeah. So it's when your kneecap gets out of place. So that can be when you have basically loose tendons around that area and the kneecap gets out of place. Bursitis.
Sorry. When I run, will it get like worn down, but like if you rest, like it build back up.
Yeah, it repairs pretty quickly. Bursitis, did we have about bursitis before?
No.
No? Anybody know what that is?
Is that anything like bursitis?
Not exactly. So tendinitis, it just means inflammation of something. So you have bursa, which are basically water balloon sacs that cushion your joints. And then if one gets popped, then you're going to have a bunch of water fill up in a certain area. One common place would be your knee when this happens. Have you ever had like a knee really swollen and just filled with fluid? That's when one of the bursa sacs pops and you have water spill out. And so you'd have this bump on your elbow if you have bursitis in your elbow right here. But it can also be in your knee. Basically where your knee just gets large. Yeah, I don't know how, I don't know. I guess so. Baker's cyst, that's a bump in the back of your knee. And it's for a similar reason to what you get with bursitis, where we have this fluid in your knee that lubricates it. And basically it's full of water. But the fluid can come out and spill out behind your knee, and that can create this bump back there. Osgood-Schlatter's disease. This is common in kids and teens who are still growing, especially if they're active. So you can see along here, you have a patellar tendon that connects to the tibia down here, this bump right here. So if you feel your knee, you have your kneecap, right? Then you have this area right here. You can feel it kind of like dips in. You're hitting your patellar tendon right there. So when doctors hit the hammer with your knee, they're hitting the tendon right here. And that tendon makes you kick out. So that's the depression you have in your knee below your kneecap. But then the next, you have two bumps. You have another bump right here. And that's the next bump you're feeling in your knee. That's the tibial tubercle. Has anybody ever had this before? When you're playing sports, you can have this bump right here. It's very painful. This is Osgood-Schlatter's disease, where the tendon pulls the bone upward. It pulls basically this piece of bone off the tibia. I had this when I was playing soccer when I was a kid, and it really, really hurt. Basically, the bone just pulls off from the tendon. And I had to wear this brace, like these steel rods that my leg just couldn't move at all, like from the thigh down to the ankle, because they wanted to have it repaired. Because if you move this at all, you're going to keep on pulling the bone off.
I was just gonna ask, why did they do that test?
It tests your reflexes. It's a good test of your reflexes, which is show if your nerves are functioning properly. So if your reflexes aren't there, it shows you a problem with your nerves, which could be really serious. So that's why they do that test, to make sure your nerves are working properly.
Wait, Miss Holly, is it bad that I've never had that test before?
Yes, it is. You got a test.
No, the doctor's never hit my knee with a hammer.
We need to do that sometime. I mean, that's why I have hammers here at school, because we do it with the nervous system next, we'll do that.
Really?
That's why we do have the hammers here, so you can all test it. But yeah, it's very important. Yeah. So it'll be next.
Wait, we're beating each other with hammers?
Yeah, I hope not. Yeah. I hope it doesn't happen. So this disease happens when the tendon is right by your growth plate. So when you're growing, you have this growth plate right here. And this is very vulnerable to being pulled off because of the growth plate right here, which is just cartilage. But once you stop growing, you're not gonna get this. It's only when people are growing or active as they're growing. If you have an injury, RICE is a common acronym. You might have heard this before. This is a really good way to recover from an injury. Resting the area for a couple of days, ice, 20 minutes at a time, 4 to 8 times per day. Compression, that helps reduce inflammation, and elevating the part above your heart. That lets the fluid drain and keeps it from swelling. Rigor mortis, we mentioned this last chapter, but we really didn't go to it in detail. So after a person dies, the muscles lock up because you need ATP to unlock the muscles. So rigor mortis is stiffness of muscles after death, where you have these protein fibers that are locked in place, actin and myosin. When you have resting muscles, the fibers lock in. ATP is required to break apart the actin and the myosin from each other. And so if you've died though, you're not producing any more ATP. And so you have ATP for a little bit, but once that's used up, your muscles just stay locked in place and they can't unlock at that point. So for muscles to move at all, you need to have these fibers unlock, and then you have the filament slide past. And that's how you have muscle movement. So investigators can tell when a person has died based on this. There's a certain time frame when you have rigor mortis, but then after a couple of days, the muscles decompose to the point where they become soft again. And so they can tell roughly, if it's been a couple of days, the time of death based on the body temperature and based on the muscle rigidity of the person.
How long does it take for it to cool off?
It depends, but in this chart right here, it says about 3 to 8 hours is when it goes from being warm to being cold. So it depends, of course, on the temperature around you,
Yeah.
but in general, it's 3 to 8 hours for the body to cool down.
I didn't finish enough in the last
sorry.
page.
So after about 3 hours, the body is still going to have ATP to use and the muscles aren't going to be rigid. But after 3 hours, it becomes rigid. So between 3 to 36 hours, the muscles are stiff. But after 36 hours, then the muscles decompose to the point where they loosen up again. And this right, you don't have to write this down, but just to give you an idea of what they're looking for in forensics. The eyelids, lower jaw, and face are the ones that start to stiffen up first. And this is just the order of which ones stiffen up first when the body has died.
So that means you can't actually close the eyes of a dead person?
Well, it depends. If it's right away, you can. Like if it's in with 3 hours, yes. But after 3 hours, no. But after 36 hours, then they loosen up again. So, but within the time frame of 3 to 36 hours, no, you couldn't. The abdomen and lower limbs are the ones that stiffen up last in the body. And so they look at things like that too. They can also tell the time of death based on what parts are loose, what parts are not loose. Livor mortis is another thing they look at when they try to determine time of death and also how the body died. And so when the body is set a certain way, gravity pulls the blood downward. And so they're going to see, it looks like bruising, but basically just, red spots or purple spots. And that's due to the blood moving down in the body. And so this lets them know which way the body was when it died and if it's been moved. So after about 2 hours, it starts to happen. After 8 hours, it's permanent. And so the body is moved after 8 hours, and they can tell. Because, if the body was laying this way when it died, and you flip it over to the other side, you would still see these red marks on the back. And you would know that the body was actually on its back when they died, not on the stomach. And so that gives you an idea of whether it was moved and how it might have died. Tetanus, you probably have heard about this before. It's something that, you get a shot for when you're young, usually. It's not a very common disease because we have the vaccine for it, but it is very serious if you get it. Patrick?
Never mind. Sorry. He doesn't want to ask a question.
So tetanus is caused by a bacterial infection. Yeah, tetanus right here.
Tetris spoken in.
Oh. Clostridium tetani
You know what?
is a bacteria, it looks like this, that infects you when you have tetanus. So in soil, anything that's really dirty, there could be these spores, bacterial spores that can go into your body. And at that point, the bacteria starts to become active and release a toxin, a poison that can severely injure you or even kill the person. It can be very serious if you get this. So if you have a puncture wound on your soil, anything that's dirty, especially, you could be you could have tetanus. But if you have the vaccine for it, then you're safe. The people who are not vaccinated would be very much at risk for tetanus if they have, especially a deep wound.
You need to get like another shot.
Yeah, after about every 10 years. They're thinking it could be stretched about 30 years between shots, but generally after every 10 years, you get a booster shot for tetanus.
So when we have it.
I think you'd have had one about age 10, right? Like 10, 12. So you'd be due for one about 20 to 22.
Does it have to be a puncture?
Well, puncture wounds are the ones that are you're most prone to getting tetanus. It could be any cut. You can have a small scrape. You get paper cut. You can get tetanus that way. It's just that the ones that are very deep are the ones that are more prone to getting tetanus. That's why we think about tetanus being from nails. It's not just from nails, but nails give you a really deep puncture wound, and that kind of wound is what makes you most prone to tetanus. So,
rubbing rust on a car, seeing if it's gonna come off.
well, if you have a puncture wound, like that's the thing. Like so, it's not the rust, it's not the metal for the nail that causes tetanus. It's having a deep wound that causes tetanus.
Oh, really?
Yeah.
I had no idea.
And so, people think it's the rust from the nail. People think it's not. It's not now you can have bacteria on the rust. That's pretty common, but it's not the rust itself. It's having a dirty surface with a deep cut that causes tetanus. So it could be a thorn, you touch it, like a thorn bush, and then you get in the soil, that can cause tetanus. It's any kind of puncture wound, especially, that can cause tetanus, not a nail necessarily. Tetanus, when you get it, the bacteria releases a toxin that makes muscles lock up. You get really painful muscle spasms, and the muscles cannot untense. They just stay locked up. And that can cause breathing problems. That's usually how it becomes deadly, is when you can't breathe, because you need a muscle to breathe, and that muscle gets locked up and you can't breathe. It locks up your jaw too, and to the point you can't unlock your jaw. And that's why it's also called lockjaw, because it gets to the point where your muscles are just so tight you can't loosen your muscles.
Can you naturally recover from it?
Not naturally, no. No, if you didn't get treatment, you die from it. You have to get treatment right away. It's an emergency. And even if you do get treatment, about 10 to 20% of people do die from it, even with treatment. So it's very deadly if you get it. That's why vaccines are really important for this. People who are not vaccinated with this, it can become very serious for them. But people who do get vaccines for it don't have to worry.
Why'd you wait till you're 2 years old? Why don't you do it when you're a lot younger?
No, I think you do. I think you get one when you're a baby, and then at 10, or between 10 and 12. And then, so you do get one when you're a baby. Yeah.
Michael has another good question.
No, it's good to ask these questions. It's okay.
I think you asked a really good question.
Everybody have these down? Now, tetanus also just means locking up the muscles. That's what, so you might just hear muscle tetanus, and in general, that just means muscles being, contracted, being pulled together.
If you did get infected, what type of treatments are?
They give you an antibody that basically deactivates the toxin. And so it's just IV of the antibody. And the vaccine, that's what the vaccine does basically for you, is you get the toxin in the vaccine, but it's deactivated. Your body doesn't know that, though. It thinks it's an active toxin. And it learns how to deactivate the toxin. And then it remembers how to do it in the future if you get it again. But if you're not vaccinated, then you don't have the antibodies, but you can get an IV transfer of the antibodies into your body, and that can help. But there's no guarantee it will actually cure it. It's very hard to treat, but that's what they'd have to do pretty much immediately. Yeah.
How soon can you know if you have?
Tetanus, it depends. It can incubate for a few weeks. The ones that are the most deadly are the ones that happen pretty quickly, which would be about a week. But ones can be 2 or 3 weeks before you actually get, because you get the spores, which are basically the eggs of the bacteria. And they have to multiply in the body first and release a toxin before you get sick. So it takes a few weeks in general for you to get symptoms.
We're out.
So Botox can be different reasons why you would get Botox. You think of it probably as just reducing wrinkles, which is one reason why you get Botox, but not the only reason why you would. But it's from a bacteria, Clostridium botulinum. It's a bacteria that releases a toxin which interferes with muscle and nerve communication. So this is the muscle cell right here. This is the nerve cell. And you have neurotransmitters, acetylcholine, which is in green on here, which goes in between the nerve and muscle cell, and that creates muscle movement. And so normally when a muscle moves, you have this neurotransmitter, acetylcholine, go across here to these receptors, and that makes the muscle contract. But what happens if you have Clostridium botulinum in your body, they can't move the green acetylcholine across this membrane right here, at which point you're paralyzed. If you can't get this muscle across from your nerve to your muscle, then the muscle cannot move. So this right here is broken apart. The toxin breaks apart this protein complex, which allows you to move the acetylcholine across from your nervous system to your muscle system. Without that transfer, your muscles can't move. And there's different reasons why you'd want this. So, one reason why would be they inject into your skin with wrinkles, and it makes your muscles loosen up. And they don't move for about, it depends, but a few months. But then over time, you have to get this over and over again. So it's temporary. It's temporary paralysis of your muscles. And then after a few months, you have to get a new injection. But besides cosmetic reasons, you would get it, your neck can be stiff, and that can help loosen up the neck. Lazy eye, have you ever seen that before? Where the eyes just don't track together. So where you have with lazy eye, one muscle is really strong. And so you might wear an eye patch to help correct that. That would be one way to do that. But what you could also do with lazy eye is just inject Botox into the muscle that's really strong. It loosens it up, and that can help correct this too. Cerebral palsy. So that's a disease where your muscles get really stiff and they can't contract, or they can't loosen up. And so this can help loosen your muscles and help reduce the symptoms of cerebral palsy. If you have excess sweating, so sometimes that's due to muscles that are just working too much. And so this can help reduce sweating in certain situations. Migraine, eye twitching. So anytime you have a muscle that's overactive, you can use Botox to help make the muscle less active. And it sounds really dangerous. I mean, this is a poison which in large amounts can kill, but in small amounts, it's very safe. So as long as you have a good doctor who's trained in this, it's very safe. It's only been a handful of cases that have been complicated in the past few decades. So, in the past several decades, they've only had, I think, 6 cases where there's been an issue. So it is very safe, even though it seems very natural and very dangerous, it's really not. But of course, long-term effects could just be, well, it kind of just stops being effective over time, where you just get natural appearances. People who have had a lot of Botox or just a lot of plastic surgeries, their face over time just looks strange. And so that would be one side effect to this, is just that your appearance just looks really unnatural over time. But as far as, having poison in your body, it usually just stays in place. It doesn't go on to your bloodstream.
It's not permanent, is it?
No, it's only a few months. So if you get Botox, it lasts for like 3 months at most. You have to go back and get it again. Everybody have those down? Okay, let's move on to chapter 7 now.
Oh, man.
Yeah, that was just notes from chapter 6. Yes. So chapter 7 is about the nervous system. So this is about, brain functioning and the nerves. So this is a functional MRI, fMRI. This works by detecting blood flow through the brain. And this lets you know what parts of the brain are activated and what parts of the brain are being in use. And so it can measure the areas of the brain that have a lot of blood flow to them, which tells you what parts of the brain are working. What they did here in this study is they had a patient think about playing tennis. And this patient was just, this control patient right here, just a normal, healthy person. And so they were thinking about tennis. And they were thinking about, swinging the racket and hitting the ball. This is a patient who was in a coma. So people who are in a coma are asleep, but they asked them the same question. And the person in a coma had the same brain activity as somebody who was awake. So this is evidence that people in comas do hear and are aware of what's around them and can have similar brain functioning to people who are awake. And this also is evidence that our activities are linked to what we think about in our brain. That's why watching sports can be really exciting because, if you watch somebody score a touchdown, your brain tells you did that. Like you're watching somebody run across the field and score a touchdown, you get excited because your body's telling you that you're the one who did that. We have these mirror neurons in our body that make us feel what we see around us. So if somebody's smiling at you, you feel happy because your brain is telling you that you're happy because you're seeing somebody else who's happy. And so we mirror what we see around us. And that's one way you can learn how to play sports is by watching people play sports. By watching somebody over and over again do something, you actually get better at playing a sport because your brain is learning how to do an activity by watching somebody do the activity. And so it's a very similar thing to actually doing the activity to watching the activity. In both cases, your brain has a similar functioning happening, whether you're watching or actually doing the activity. The same parts of the brain are activated. Did you have a question, Carl?
Yeah. So you said that the coma patients show the same brain activity. When they wake up, if they do they know about do they actually remember that?
They do have some memories. Yeah. And so not everything that they remember because it's all converted to long-term memory. You have about a 20-second window for you to have it converted from short-term to long-term memory. So you do have to have that. But if you do, then why is that happening? Sorry, let me go back to this really fast. It's so strange. But yes, if they do have that conversion to long-term memory, they do remember things. Did Zoom just quit on me? Huh. But there are stories of coma patients who will just overhear people talking about them. That they'll hear family members in the room and they'll just hear conversations. They don't remember the conversations people had about them. They thought they were asleep, but they could hear them. So they do definitely have memories of being in a hospital. How much, it just depends on the person.
Do you think that's because they can still hear their name? Their brain activates?
I'm sure that's definitely part of it. That definitely is part of it, is that they but just in general, they can hear everything. Like your ears don't shut off. I mean, when you're asleep, your ears still work. And so you are aware of your surroundings all the time when you are asleep. And so definitely if they hear their name, they're going to be more alert than normal, but they're going to have alertness no matter what they hear, whether it's their name or something else. Yeah, I have. It's terrifying. Yeah. I mean, I think it depends on person to person, right? I mean, it's just like asking about, well, how is sleeping for person to person? Some people who are asleep, it's peaceful. other people who are asleep, it's not peaceful at all. They have nightmares, they have night terrors. So it just depends on the person. So that's why it's hard to answer that question, because it's just everybody is different. Nobody is the same. People experience sleep the same way or the coma the same way. And so some people, yeah, it'd be really terrifying. Other people, they'd be really peaceful. So I don't know why it's doing this. Let me see. Yes.
Is there like a condition when you fall asleep whenever you're experiencing this? Like there's people who like will fall asleep, like they can't really control, they'll fall asleep super suddenly. What is that?
Wait, Rose, are you talking about narcolepsy? Yeah.
Yeah, narcolepsy.
But as a kid, had a guy with that, but then he had like night terrors and stuff. And
Yeah, it's pretty terrifying. That's usually narcolepsy usually is due to not sleeping well at night, and usually you just don't have restful sleep. You might be asleep for 7 hours, but it's not restful sleep, and so you have to find a way to get restful sleep. Because if you are sleep deprived, you are going to eventually find a way to fall asleep. Your body cannot survive without sleep for 10 days. So your body will find ways to shut down and get sleep. Even it's micro sleep. I mean, so if you're really sleep deprived, you might fall asleep for a minute, and you might even know you were asleep for that minute. Your body finds ways to rest, and that would be a case when it does that. It's just passing out really fast. So MRIs work so in your body, you have a lot of water. And so hydrogen is an atom in water. MRIs affect the hydrogen atom that's found in the water in your body. And it's magnetic. And so it's a huge giant magnet in the MRI machine, which if it's magnetized, it makes the hydrogen atoms spin in a certain way. Half spin up, half spin down. But there are a few that are not paired up. The ones in green are not. And so it's those few that are not paired up that show up at the MRI. So the ones that are in green that are not paired up are going to release energy. And the energy that's released gives you an image that you see. So MRIs are good for soft tissue. Bone can show up in certain situations, but for the most part, it's used to show organs. And so if you want to see an organ, like a brain, for example, or liver, or if you want to see things like cartilage, tendons, ligaments, MRIs is the best way. So if you have, say MCL tear or ACL tear, you're gonna use MRI to see if it's torn. It shows you soft tissue. Okay, the nervous system. Let's go through the functions of the nervous system. So one thing that it does is input sensory information. So it takes in things around you, both inside the body and outside of the environment. It takes information about the environment, about things like temperature. You guys taking notes back there?
Yeah.
So it gathers information about the body inside and outside. It's important because the body constantly has to monitor its how it's doing and make corrections all the time. It's how you survive. And so your body has to make tiny corrections throughout the day to make sure, because you only survive in a very small range of levels. If they're outside of a range of levels by even a small amount, your body can't function. So think about, you have a short range of temperature that you can be in. If it's below 80 or so, about 85 degrees in your body, then your body just shuts down. You get hypothermia and your body can't function. It becomes fatal at below 80 degrees Fahrenheit in your body. And above 108 degrees Fahrenheit, your body also shuts down and it becomes deadly. Your proteins just unravel at that temperature. Just like an egg is cooked on a stove, you see the protein in the egg change form. Same thing with the brain. The protein in the brain also changes its form, and to the point where it can't function. And so temperature, also pH levels, salt levels, you have a small range of values that outside that range of values, you die. Yeah, lethal injections all they do to kill a person with lethal injections is inject salt into the body. That's all they do. Potassium chloride, which is just table, you can eat that salt. It's found in table salt.
Really?
But if you put that salt into your bloodstream, that will kill you because you change the amount of potassium in your body, chloride, calcium. It's a mixture. It's salt water. Yeah. Well, it's enough to kill you. Yeah.
Is that why they say like salt in the food or something? Like-
Well, salt burns. Salt burns, and that's why.
So what if you have an open cut and salt gets in?
Yeah. So then you would well no, because it wouldn't, because your body is able to shut off really quickly. It closes the wound.
Oh,
So you need an IV of salt for it to be deadly.
Sorry, Miss Holly. So Maria twisted her ankle.
Oh,
She's
no.
like crying in the bathroom.
Oh.
Do you have anything for her?
Well, I do have some ice packs.
Shut up, dude. You're the worst person.
Yeah, I think something out of that.
Okay, so can you do
Yes.
What have you done?
Thank you.
Maybe.
No, you're good.
No.
I forgot what we were saying now. Oh, salt in the wound. So they would put salt in the wound because salt kills bacteria. Salt kills cells. And so before they had antibiotics, they would use salt to kill bacteria. It's also why they salt meat, because that would just keep it from rotting. But salt also burns. And so that's why salt in the wound is very painful. But if you don't have any medicine, then salt would also save your life. It would keep infections from happening.
What happens if you get like a cut?
Well, your body is able to block off. So unless you had an IV of salt water, you wouldn't die. But because your body is able to block off water from going, it's basically a one-way valve. You're bleeding out, but you're not getting much in. And so it's kind of like a water faucet, like where it's just coming out. But you can't get much into your body. You need to have a needle, you need to have an IV for it to actually go into your bloodstream. Your body blocks that very fast. Yeah.
So what's the difference between saline and that?
It's just a small amount of salt. And so with a saline solution, it is the same amount of sodium and chloride levels as in your body. But lethal injection has a lot more potassium and chloride than normal. And that becomes deadly at that point. So it's just the amount that's different. It's still salt in both cases, but one amount is what your body actually has and needs to survive. The other amount is just a lot, and it stops your heart from working. Some people have actually survived them. It's incredibly painful, but some people have it. They've said that it feels like you're burning, like that when they inject that salt. If you are conscious, that what they do is they have a first medicine that puts you to sleep, because if you are awake for the salt injection, it's incredibly painful. It just feels like your whole body is on fire. And so they first knock you out before they do that. But yeah, if you're awake for that, it'd be terrible. But people have been known, not very often, but it has happened where people have survived that. It's terrible. Besides just thinking about, or besides just monitoring your surroundings and your body environment, the nervous system also is going to function for integration, where it makes sense of the information. There's no homework tonight. Have a good day.
Being in the ocean actually attracts sharks.